The Adirondack Foundation Community Trust in Lake Placid has been holding meetings throughout the Adirondacks for more than a year now with partners and stakeholders who help provide the social safety net that more and more families here in the region are counting on. In fact, their survey found in the years after COVID, as many as 40% of the families that live here in the Adirondacks are struggling with food insecurity. It is a pleasure to welcome Lori Bellingham, who is Vice President of Community Impact with Adirondack Foundation. Welcome back. It's nice to see you again.
Good morning. Thank you.
Lori, why don't we start with a little background on this project? The Adirondack Foundation brought together stakeholders last year to talk about how to strengthen the social safety net in communities. How did the project come about?
Adirondack Foundation is a community foundation, and community foundations serve particular geographies. So our service area is the Adirondack Park, north to the Canadian border. So yes, we had a lot of conversations over the last couple of years, and really it was our work coming out of COVID. So as we came out of COVID, we were inspired by the organizations that were working so hard across the region. During that time, we were supported by generous people across the region who allowed us to step in and provide over $2 million of support to organizations on the front lines. In the wake of the pandemic, we found that organizations were tired, just as everybody was. And in some cases, their connections and their partnerships were frayed. So you often hear the term the safety net of services for people, and that safety net, we wondered about its resilience, right? Were organizations able to continue to provide the services? Were there gaps? And could we leverage our ability as a community connector, bringing together people, ideas, resources that could potentially reweave the social safety net following the pandemic?
Things like food insecurity, housing, childcare, I mean, a whole array of social services to see how they all were doing.
So this has become a 3-year initiative by the foundation. So when we asked those questions of ourselves following the pandemic, we decided to start with research. And as I said, we leverage all of our skills. So while we're marshaling resources for grant making, our staff is also quite connected to the organizations across the region and connected to them and helping make connections amongst them. The research that we started with was a report, a state of the social safety net. We were grateful for funding from Mother Cabrini Health Foundation. We have a terrific partnership with the John Ruggie Center for Community Impact at Hudson Headwaters. And we started with a report and with the research. And what we did, there's many good organizations across the region that are looking at the needs, right? Our counties take needs assessments, Adirondack Health Institute, the really important work done by United Way, looking at the ALICE data. So we took existing data and we supplemented that with interviews of approximately 100 providers across the region. And together, you may not be surprised, there was agreement on what the top 6 regional needs were that contributed to people's general health. Access to health care, specifically specialty care, access to healthy food, transportation, housing, workforce stability, so including childcare, so needs that you have to be able to work. And then, interestingly, social cohesion, so the need to be connected by people, sometimes talked about on the other side as social isolation. So there was agreement about what those top 6 needs were, and we invited more than 300 organizations to come together, to get connected again, and to talk about what actions they might be able to take to address these needs. We came out of those conversations learning a lot. We held 4 across the region, full-day conversations. We learned a lot about what ideas they had as they came together and reconnected. Could they think of new ways or reconnect over existing ways to address these issues? We also learned that the primary need for these organizations from us and others was the time and the tools and the support to reconnect and develop partnerships.
And out of those 6 that you talked about, was there one that was at the top of the list, whether it be food insecurity or healthcare or housing, or did you look at it all 6 and identify that all 6 were critical?
Regionally, there was agreement that all 6 were critical and that they're so interconnected, right? And so again, what the organization said is they can't do their work alone. They need to do the work together. So if they're working in housing, they need to be working with the social care organizations or the food access organizations, and vice versa. So what they were asking from us was that ability to connect. So we took what we learned and we put together collaboration labs or workshops. We invited organizations that wanted to work in partnerships to bring their partners together. We offered tools that would help them strengthen their partnerships. We offered the time for them to develop those partnerships. From there, we developed a grant process that will support their planning. So we're offering some planning grants, and following that, implementation grants that will be 3-year grants of $150,000 to implement the ideas that they have. And you asked about, was there one area of need that took a priority? No, I think that everybody understands, depending on which organizations are in their region. So if you don't have an organization addressing food security, it's difficult to address food security. However, as partners, they may be able to address food security in a way that they haven't been able to before. Partnerships are considering expanding supportive housing, expanding social services, whether it's, again, in a new geography or into new locations, such as libraries. We're seeing a lot of conversation about libraries as centers for communities, along with schools as centers of support for communities. We're seeing workforce development, so support for soft skill development for young adults trying to get into the workforce. Of course, childcare, and some conversation from partners that are looking to decrease the time that it takes to be evaluated for mental health needs.
And you talked a little bit about community schools. That's a program that's been around for a few years now. At some schools here in the Adirondacks, do you see that as playing a big role in doing what you want to do here? Do they provide a number of services where they could step in and be a partner to help with this?
Absolutely. Community schools are a model. Schools have been able to, Saranac Lake is one that we have in our region, have been able to bring this model of being a hub for families and individuals in the community, right? They are the folks, frankly, that are doing outreach to families on a daily basis. They're in contact with so many in our community, and so they have that opportunity to connect people to the types of services that we're talking about. They essentially could be an outreach coordinator for families and individuals in the community. You've done a lot of work to talk about the need in our region in those specific areas that have come out of our report. One piece of data that really struck us was that on any given day, 40% of the people who live in our region are struggling to access food, shelter, childcare, any number of the things that are required for them to live a healthy and vital life.
Did that surprise you that it was that high?
Yes.
Can folks read the study if they'd like to?
They can.
And where can they find that?
Yeah, they can find the study online at adirondackfoundation.org, and they can also find a summary of the conversations that were had amongst organizations in June of last year.